This podcast is for educational and informational purposes only. I am not a doctor and I am not giving medical advice. Peptides are research compounds that are not FDA approved for most uses, and laws vary by location. Always talk to a qualified healthcare professional before starting or stopping any medication, peptide, supplement, or health protocol. Never use peptides if you are pregnant, breastfeeding, under 18, or have a serious medical condition without medical supervision. If you have severe pain, swelling, shortness of breath, chest pain, or signs of infection, seek medical care immediately. Welcome back to the show. Today we are talking about one of the most popular peptide combinations in the entire peptide world, and that is BPC-157 and TB-500. If you have spent any time in peptide groups, gyms, biohacking circles, or injury recovery communities, you have heard these names. And if you have not, you are about to understand exactly why people love this combo so much. Because when it comes to healing, repair, inflammation, and getting your body back online, BPC-157 plus TB-500 is one of the most talked about duos for a reason. So today I want to break it down in plain language. What is BPC-157? What is TB-500? Why do people stack them? How do they work differently? What kind of injuries do people use them for? What does the research actually suggest? And what do you need to understand about dosing styles, timing, cycles, and realistic expectations? Because this combo gets hyped up a lot. Sometimes appropriately. Sometimes irresponsibly. So, I want you to walk away from this episode feeling confident, informed, and grounded in what the stack is and what it is not. Let's start with BPC-157. BPC stands for Body Protection Compound. BPC-157 is a peptide fragment that was originally identified in gastric juice, meaning it is associated with the stomach and digestive system. It is a chain of 15 amino acids. And even though it comes from the gut environment, it has become famous for whole-body healing effects. That sounds wild, right? Something from the stomach is now being used for tendons, muscles, joints, ligaments, and even nerve-related recovery discussions. But when you look at the research, especially animal research, it starts to make more sense. BPC-157 has been studied mostly in rats and other animal models. And the research suggests that it may support tissue healing by influencing several important systems in the body. For example, BPC-157 appears to play a role in angiogenesis. That is the process of creating new blood vessels. And if you think about healing, blood flow is everything. You cannot repair tissue efficiently if the area has poor circulation. Blood delivers oxygen. Blood delivers nutrients. Blood removes waste. Blood brings immune system support. So the idea that BPC-157 may help improve blood vessel formation is one of the reasons it is associated with faster healing. BPC-157 is also discussed for its effects on inflammation. And inflammation is tricky because inflammation is not always bad. Inflammation is part of healing, but chronic inflammation is where problems start. Chronic inflammation keeps tissues irritated, swollen, stiff, and painful. So when people say BPC-157 reduces inflammation, what they usually mean is that it may help regulate inflammation in a more productive way. Not just shutting it down, but shifting the environment into a healing state. Another reason BPC-157 is so popular is because it is associated with tendon and ligament healing. And tendons and ligaments are notoriously slow to heal. They do not have as much blood supply as muscle. They take longer. They often re-injure easily. And they are very frustrating. So anything that might help with tendon repair becomes extremely popular in sports medicine and fitness communities. Now, another interesting area where BPC-157 gets attention is the gut. Because remember, it originates from the stomach environment. So BPC-157 is commonly discussed in relation to gut lining support. Things like ulcers, leaky gut discussions, inflammatory bowel issues, and digestive inflammation. Again, most of the research is not in humans, but it is one of the reasons some people claim they feel better overall when using it. Because gut health affects everything. Energy, mood, immune function, skin, inflammation, and even hormones. Now, let's talk about TB-500. TB-500 is often described as the synthetic version of a peptide called thymosin beta-4. Thymosin beta-4 is naturally occurring in the human body. It plays a role in tissue repair, immune function, and inflammation regulation. But TB-500, the one people buy and talk about in peptide circles, is typically a modified fragment or version that is used for research purposes. TB-500 is known for systemic healing effects, meaning people do not just use it for one spot. They use it for overall recovery. The big thing TB-500 is known for is its effect on actin. Actin is a protein involved in cell movement and structure. And when cells can move properly, they can migrate to injury sites, rebuild tissue, and assist in repair. TB-500 is often associated with increased cell migration. That includes cells involved in healing, like fibroblasts. Fibroblasts are important because they produce collagen and help rebuild connective tissue. So if BPC-157 is like a focused repair peptide that people associate with tendons and inflammation, TB-500 is often described as a broader, more systemic repair peptide. It gets talked about for muscle injuries, joint pain, ligament issues, inflammation, recovery after intense training, and even mobility improvements. Now, something else TB-500 is commonly associated with is improved flexibility. You will hear people say things like, "My body feels looser," or "My shoulders stopped feeling stuck," or "My knees feel smoother." That is anecdotal, but it is a consistent theme. Now, the real magic is when you combine them, because BPC-157 and TB-500 are not the same. They are not redundant. They are complementary. Think of it like this. BPC-157 is often considered the injury site healer, the one that supports tendon repair, inflammation regulation, and localized healing. TB-500 is more like the body-wide repair coordinator. It supports cellular migration, muscle recovery, and systemic healing processes. So stacking them is like hiring two specialists. One is working on the construction site. The other is managing the supply chain, the crew, and the overall project timeline. Together, they create a more complete healing environment. That is why people love this combo for injuries. Now, what kind of injuries are we talking about? Let's go through the common ones. One of the biggest reasons people use this stack is for tendinitis. Tennis elbow, golfer's elbow, Achilles tendinitis, patellar tendinitis, rotator cuff irritation. And if you have ever dealt with tendinitis, you know it is miserable. It can feel like it will never go away. You rest it, it feels better. You train again, it flares up. It is a cycle. So BPC-157 plus TB-500 is often used in that frustrating middle zone where the injury is not severe enough for surgery, but it is severe enough to limit your life. Another major category is ligament sprains, knee sprains, ankle sprains, wrist sprains, shoulder instability. Ligaments heal slowly, and they heal even slower if you keep using the joint. So people use this combo hoping to speed up recovery time and reduce chronic inflammation. Another huge category is muscle tears or muscle strains, hamstring strains, calf pulls, quad strains, groin pulls. And TB-500 in particular gets a lot of attention for muscle recovery, because muscle tissue heals faster than tendons, but it still takes time. And if you return too early, you can easily re-injure it. So people use TB-500 to help rebuild the tissue more efficiently. Then you have joint pain. This is a big one. Knee pain, shoulder pain, hip pain, lower back stiffness. And I want to be clear, joint pain is not always an injury. Sometimes it is inflammation. Sometimes it is cartilage wear. Sometimes it is biomechanics. Sometimes it is weakness or instability. So peptides are not a magic fix if your movement patterns are the real problem. But many people claim this combo helps reduce pain enough that they can start rehab exercises again. And that is actually an important point. The goal is not just pain relief. The goal is pain relief plus repair. Because pain relief without fixing the issue is just masking. But pain relief that allows you to start strengthening, stretching, and correcting the injury is valuable. Now, another area people talk about is post-surgery recovery. Now, obviously, surgery recovery is serious, and anyone recovering from surgery should be working closely with their doctor. But in peptide circles, you'll hear people talk about BPC-157 and TB-500 after orthopedic surgery. Knee scopes, rotator cuff repair, ACL reconstruction, tendon repairs, even dental surgery, surprisingly, because the mouth heals quickly, but inflammation and tissue repair are still part of the process. So people use these peptides as part of their overall recovery strategy. Now, let's talk about something important. How does this combo actually feel? Because people will ask, how will I know it's working? Here is the honest truth. Some people feel it fast. Some people feel nothing until weeks later. And some people do not feel anything at all. And that is not because it does not work. It is because healing is subtle. Sometimes the biggest sign it is working is you realize you are not thinking about the injury anymore. You wake up and your first thought is not your knee. You walk upstairs and you are not bracing for pain. You get out of the car and you are not stiff. You realize you can lift your arm overhead again. That is often how healing shows up. Not as a dramatic overnight change, but as a gradual return to normal. Now, some people report a noticeable reduction in pain within the first week, especially with BPC-157. They say inflammation calms down. The area feels less irritated. They can move without sharp pain. That is common. TB-500 sometimes takes a little longer to feel, but people often describe improved mobility and recovery over a few weeks. Now, let's talk about how people use this stack. There are two main styles: localized use and systemic use. Localized use means you are targeting a specific injury, like a shoulder tendon, an elbow, a knee, an Achilles. People often inject BPC-157 near the injury site, not directly into the tendon, but in the area. Subcutaneous injections close to the injury. The idea is to saturate the local tissue environment. TB-500 is more often used systemically, meaning injected subcutaneously in a general area like the abdomen, and it still circulates through the body. Some people also inject TB-500 near the injury, but the more common approach is local BPC-157, systemic TB-500. Now let's talk about dosing, because I know you are wondering. But I want to be careful here, because I am not giving you medical advice and dosing is highly individual. However, I can talk about common research community protocols that people discuss. For BPC-157, many people use doses in the range of 250 micrograms to 500 micrograms per day. Some people do it once daily. Some split it into two doses. For example, 250 micrograms in the morning and 250 micrograms at night. That is a common strategy. And they often run it for 4 weeks, 6 weeks, or 8 weeks depending on the injury. For TB-500, the common approach is a loading phase. People often do something like 2 milligrams twice per week or 2 to 2.5 milligrams twice per week for 4 to 6 weeks. Then they may switch to a maintenance dose, like 2 milligrams once per week. Now, do people always do it that way? No. Some people do TB-500 once weekly. Some do it every 3 days. Some do it in smaller doses, more frequently. But the general theme is that TB-500 is not always taken daily, like BPC-157. It is often taken in larger doses, less frequently. And the reason is because of its half-life and systemic nature. Now, when people combine them, a very common approach is daily BPC-157 plus twice weekly TB-500. That is one of the most popular injury stack formats. Now, let's talk about cycling. Most people do not take BPC-157 and TB-500 forever. These are typically used in cycles. A common cycle is 4 to 8 weeks. Sometimes 12 weeks for stubborn injuries. Then people take a break. Now, why take a break? Because you want to see if the injury is actually healed. And you also want to avoid relying on any compound long-term without necessity. Also, many people are using these peptides because they are trying to heal something. Once the injury is healed, you stop. You do not keep hammering the gas pedal forever. Now, I want to address something very important. This combo is not a substitute for rehab. It is not a substitute for physical therapy. It is not a substitute for proper movement. If you have shoulder pain because your posture is terrible and your rotator cuff is weak, peptides might reduce inflammation, but you will re-injure it. If your knee pain is coming from weak glutes and poor mechanics, peptides might help you recover, but you will go right back to pain if you do not fix the root issue. So the best use of BPC-157 and TB-500 is to pair it with intelligent recovery. Stretching, strengthening, mobility work, proper warm-ups, good sleep, adequate protein intake, hydration, electrolytes, and reducing training intensity while healing. That is when people get the best results. Now, let's talk about another major topic: side effects. Because every compound can have side effects, and peptides are no exception. BPC-157 is generally considered well-tolerated in the research community. Most people report minimal side effects. Some people report mild fatigue. Some report mild nausea. Some report headaches. But overall, it is usually described as gentle. TB-500 is also usually described as well-tolerated. But some people report feeling tired during the loading phase. Some people report mild water retention. Some people report lightheadedness. And some report increased appetite. Now, here is where it gets controversial. There are discussions about TB-500 and cancer risk. And I want to address this clearly. The concern is not that TB-500 causes cancer directly. The concern is that anything that increases cell migration and tissue growth processes could, in theory, support the growth of existing tumors. That is the concern with many regenerative compounds. So if someone has active cancer, suspicious growths, or a history of certain cancers, they need to be extremely cautious and should not be experimenting with regenerative peptides without medical oversight. That is just common sense. The same goes for anyone with unexplained lumps, unexplained bleeding, or major unexplained symptoms. Do not self-experiment. Get checked out. Now, another side effect topic is injection site issues. Because these peptides are commonly injected subcutaneously, that means under the skin, common side effects include redness, itching, a small bump, soreness, sometimes bruising. That is normal for many injectable compounds. But severe swelling, heat, spreading redness, or fever is not normal. That could indicate infection or contamination, and that requires medical attention. Now, let's talk about why people say this combo feels stronger than using one alone. It is because healing is multifactorial. Your body needs inflammation control. It needs blood flow. It needs collagen formation. It needs cellular migration. It needs proper signaling. It needs nerve repair. It needs growth factors. It needs the immune system to behave correctly. It needs the extracellular matrix to rebuild. So when you use BPC-157, you are hitting certain pathways. When you use TB-500, you are hitting different pathways. So together, it creates a broader, healing environment. And that is why some people feel like the combination is the real secret. Now, let's talk about timing. When should you start? In the research community, many people start BPC-157 and TB-500 as soon as they get injured, especially if it is a strain or tendon issue. But if it is an acute injury with major swelling, sometimes the body needs a short period of rest first, because you want to make sure you are not masking pain and continuing to damage the tissue. So early use can be helpful, but you still need to be smart. Now, how long does it take? This depends on the injury. For mild tendon irritation, some people report improvement in 1 to 2 weeks. For chronic tendinitis that has lasted months, it might take 4 to 8 weeks. For major injuries, it might take 12 weeks. For a torn tendon or severe tear, peptides are not magic. They are not replacing surgery. They may support recovery, but they do not replace structural repair. So, expectations matter. Now, I want to talk about a few specific conditions that people often ask about. Let's start with shoulder injuries. Rotator cuff pain is extremely common, especially in people who lift weights, especially in people who sit at desks, especially in people with poor posture. BPC-157 is popular for shoulder pain because it is often tendon-related. TB-500 is popular because shoulder injuries also involve inflammation and limited range of motion. So this combo is very common for shoulder recovery. Now, elbow tendonitis. Tennis elbow and golfer's elbow are some of the most stubborn injuries. People use BPC-157 because it is associated with tendon repair. TB-500 because it may improve overall tissue remodeling. This is one of the most classic use cases for this stack. Now, Achilles tendonitis. This one is notorious. It can take months to heal, and if you keep running or jumping, it can become chronic. So many athletes use this combo for Achilles issues. But Achilles recovery still requires slow strengthening, eccentric calf raises, mobility, and gradual return to activity. Peptides do not replace that. Now, knee pain. Knee pain can come from so many sources. Meniscus irritation, patellar tendonitis, ligament strain, inflammation, overuse. BPC-157 and TB-500 are often used because they may help reduce inflammation and support tissue healing. But if your knee pain is from cartilage degeneration, peptides may not fix that fully. They might reduce inflammation, but cartilage regeneration is complex. Now, let's talk about back pain. This is another big one. People use BPC-157 and TB-500 for back pain, but back pain is tricky. Back pain can be muscle strain. It can be disc issues. It can be nerve irritation. It can be posture. It can be stress. So some people feel amazing on this combo, and some feel nothing. But if your back pain is inflammatory or muscle-based, it makes sense that tissue repair peptides could help. Now, what about nerve injuries? BPC-157 is sometimes discussed in relation to nerve repair. There are animal studies suggesting it may influence nerve regeneration and nerve healing. But again, human data is limited. Still, people often use it for nerve pain, sciatica, or post-surgical nerve irritation. TB-500 is less talked about for nerves directly, but because it supports healing overall, it is still included in nerve recovery stacks. Now, let's talk about something else. The gut. BPC-157 is sometimes used for gut inflammation. And interestingly, when someone has gut inflammation, they often have systemic inflammation that can affect joints, skin, mood, autoimmune issues. So some people use BPC-157 and report improvements not only in injuries but also in digestion. Again, anecdotal, but consistent enough to mention. Now, a major question people ask is, do I need both? And here's my answer. No, you do not always need both. If you have a mild injury, BPC-157 alone might be enough. If you have a major systemic recovery situation, TB-500 alone might help. But if you have a stubborn injury, especially connective tissue related, and you want the most comprehensive healing support stack, the combo is popular for a reason. Now, let's talk about why people say TB-500 feels like it helps multiple injuries at once. Because it often does, at least subjectively. Someone might have shoulder pain and knee pain and hip tightness. They start TB-500 and suddenly they feel more flexible. That is why TB-500 is sometimes called a whole-body repair peptide. Now, BPC-157 is often described as more targeted. People often say, it feels like it's healing the exact injury I'm focusing on. That is why the combination feels so powerful. Now, I want to mention something important about quality. Peptides are only as good as their source. Contamination is a real issue. Incorrect dosing is a real issue. Mislabeling is a real issue. So if someone is going to use peptides, purity testing matters. Storage matters. Reconstitution matters. Sterile technique matters. Because an infection from poor injection practices is far more dangerous than most peptide side effects. So if you are not educated on sterile injection technique, you need to learn before doing anything. Now, let's talk about reconstitution because people ask this constantly. BPC-157 and TB-500 are usually supplied as lyophilized powder, meaning freeze-dried. You reconstitute with bacteriostatic water. You swirl gently. You do not shake aggressively. You store it in the refrigerator. You use insulin syringes for subcutaneous injection. That is the common approach. And dosing depends on how many milligrams are in the vial and how much water you add. This is where people get confused. Because someone will say, I have a 5 milligram vial. Okay. That does not tell you the dose until you know how many milliliters of bacteriostatic water were added. So dosing always comes down to simple math. Milligrams divided by milliliters equals concentration. Then you convert that into micrograms per unit on the syringe. And if you mess up that math, you can accidentally take way too much or way too little. Now, is taking too much dangerous? Not necessarily in the short term, but it can increase side effects. It can waste product. And it can lead to unrealistic expectations. So dosing accuracy matters. Now, another question people ask is, can I stack this with other peptides? And the answer is yes, people do. But stacking too much at once can make it hard to know what is working. A common stack is BPC-157, TB-500, and maybe GHKCU for skin or tissue repair. Some people add thymosin alpha-1 for immune modulation. Some add CJC and ipamorelin for growth hormone support. Some add IGF-related peptides. But stacking becomes advanced quickly. And if someone is new, the BPC and TB combo alone is already powerful. Now let's talk about what this combo is not. It is not a steroid. It is not going to make you instantly stronger.
It is not going to melt fat.
It is not a performance enhancer in the sense of giving you energy like stimulants. What it may do is help you recover faster. And recovery is performance. Because if you recover faster, you can train better. But it is not the same as taking something that directly increases muscle mass overnight. Now, another thing it is not is a substitute for rest. People often make the mistake of feeling better and then pushing too hard too fast. And then they re-injure. So if you are using these peptides, you need to respect the healing window. If your pain is improving, that is a sign you should start rehab, not a sign you should go max out. Now, I want to talk about realistic timelines. Because people hear healing peptide and they think they will be back in the gym in 3 days. That is not realistic. If you have a tendon injury, you should think in weeks, not days. If you have a ligament injury, you should think in weeks to months. If you have chronic inflammation, you should think in months. So peptides can speed up healing, but they do not eliminate biology. Now, I want to talk about one of the biggest reasons this combo has such a strong reputation. And it is because injuries are so common. Almost everyone has some kind of nagging pain. And conventional medicine often does not have great solutions for chronic tendon pain.
You get told to rest.
You get told to take anti-inflammatories. You get told to do physical therapy. And those are all valid. But sometimes people feel like they are stuck. And then they try BPC-157 and TB-500, and suddenly they feel like their body is finally moving forward again. That is why this combo has almost a legendary reputation. Now, I also want to mention that because it is so popular, it gets exaggerated. People claim it healed a torn ACL. People claim it healed things that probably healed naturally with time. Or they claim it did things that might not be physiologically possible. So, keep your expectations realistic. This combo is best seen as support. Support for healing. Support for inflammation control. Support for tissue repair. Not as a miracle. Now, let's talk about what people typically report during a cycle. Week 1, many people report reduced inflammation and pain, especially if the injury is active. Week 2 to 4, many people report increased range of motion and improved function. Week 4 to 8, people often report that the injury feels stable again. And then after stopping, many people report the improvement continues. Because tissue remodeling continues after the cycle ends. Now, if someone stops and the pain returns immediately, that suggests the underlying cause was not fixed, or the injury was not fully healed, or they returned to activity too quickly. Now, another question is, can you use BPC-157 and TB-500 preventatively? People do, but that is controversial. Some people use low-dose BPC-157 when training hard. Some people use TB-500 occasionally as a recovery boost. But in my opinion, the best use is injury recovery, not constant preventative use. Because you want to reserve these tools for when your body actually needs repair support. Now let's talk about a big topic. Oral BPC-157. Some people take BPC-157 orally. There are discussions about it being stable in the stomach environment since it originated from gastric juice. But injectable use is more common for injury recovery. Oral use is more commonly discussed for gut issues. Now, TB-500 is typically injected. Now, another thing people ask is, can I take them on the same day?
Yes.
People often take BPC-157 daily and TB-500 on specific days. For example, Monday and Thursday, or Monday and Friday. And BPC-157 continues daily. Now, do you need to separate injections? Not necessarily. Some people mix peptides in the same syringe. Some do separate injections. Mixing depends on stability and personal comfort, but many people keep them separate. Now, another question. Should I inject near the injury or in the belly? For BPC-157, injecting near the injury is common. For TB-500, injecting anywhere subcutaneously is common. Now, I want to mention that there is a lot of debate about whether localized injection actually matters, because peptides circulate. But many people swear that injecting close to the injury gives better results. And in the absence of definitive human data, we can only say that this is a widely reported practice. Now, what about pain management? If you are using this combo, you still need to manage pain intelligently. Ice can help in acute injuries. Heat can help with stiffness. Compression can help swelling. Massage can help blood flow. But do not overdo anti-inflammatories like NSAIDs constantly, because inflammation is part of healing. You do not want to shut down the entire process. You want to regulate it. So use common sense. Now, let's talk about lifestyle factors. Because if you are trying to heal, you need to treat healing like a full-time job. Sleep is huge. If you are sleeping 5 hours per night, you're not healing optimally. Protein is huge. If you are under-eating protein, your body does not have the building blocks for repair. Hydration is huge. If you are dehydrated, circulation and tissue repair suffer. Micronutrients are huge. Vitamin C is important for collagen formation. Magnesium is important for muscle relaxation and nervous system balance. Zinc supports immune function and tissue repair. Omega-3 fatty acids can support inflammation regulation. So peptides are not a replacement for nutrition. They work best when your body has what it needs. Now, let's talk about who should not use this stack. People with active cancer. People with suspicious growths. People who are pregnant or breastfeeding. People under 18. People with severe autoimmune conditions should be cautious and speak to a physician. People with bleeding disorders should be cautious. And anyone who is not willing to practice sterile technique should not be injecting anything. Now, what about athletes? This is another controversial area. Some sports organizations ban TB-500 and related compounds. So if you are a competitive athlete subject to drug testing, you need to be aware of your sports rules. Do not assume peptides are invisible. Many organizations consider them performance-enhancing. Now, I want to talk about something interesting. The emotional side of injury recovery. Because when someone is injured, it affects their identity. Especially if they are an athlete. Especially if they are a gym person. Especially if they use training as therapy. Being injured can be depressing. It can make people feel stuck. So when someone uses BPC-157 and TB-500 and starts feeling improvement, it can feel like hope, like momentum, like relief. And that emotional component matters. Because stress slows healing. When your nervous system is in constant fight or flight, healing is harder. So if peptides help someone feel like they are moving forward, that can indirectly support healing too. Now, does that mean it is placebo? Not necessarily. But mindset is always part of recovery. Now, let's talk about one more thing. The difference between pain relief and healing. Because some people will take the stack, feel pain relief, and think they are healed. But pain relief is not always healing. Pain relief can come from reduced inflammation. Healing means tissue remodeling and strengthening. So even if you feel better, you still need to progress slowly. You still need to strengthen the area. You still need to rebuild stability. because otherwise you are just delaying the next injury. Now, if you are wondering, is this combo worth it? Here is the best way to think about it. If you have a nagging injury that is not improved with rest, physical therapy, and time, and you are looking for an extra tool, this is one of the most popular stacks for that reason. If you have a minor ache that will resolve with rest, you probably do not need it. If you have a severe injury requiring surgery, this is not a replacement. But if you are in that middle zone where you are stuck, this combo is one of the most commonly discussed for pushing recovery forward. Now, I want to quickly summarize the difference one more time. BPC-157 is commonly associated with tendon healing, inflammation regulation, gut lining support, and localized injury repair. TB-500 is commonly associated with systemic tissue repair, cell migration, flexibility improvements, and muscle recovery. Together, they are often used as a comprehensive injury recovery stack. Now, I want to end this episode by giving you a realistic, grounded approach to this combo. If you are using BPC-157 and TB-500, you should do 3 things. Number 1, treat the injury like it matters. Stop doing the activity that caused it. Modify training. Rest the area. Number 2, support healing with nutrition and lifestyle. Protein, sleep, hydration, minerals. Number 3, rehab.
Stretch.
Strengthen. Improve mobility. Correct movement patterns. Because peptides can help accelerate repair, but they do not teach your body how to move correctly. Now, I also want you to remember that pain is information. If something hurts, do not ignore it. Do not inject and push through. Use the peptides to support healing while you respect the injury. That is how you get the best outcome. And if you do that, this stack can be one of the most useful peptide combinations out there for real-world recovery. Now, before we close, I want to leave you with one final thought. The most powerful part of peptide therapy is not the peptide. It is the strategy. It is knowing why you are using something, what you expect it to do, how long you will use it, and what lifestyle changes you are pairing it with. That is how you use peptides intelligently. That is how you avoid wasting money. That is how you avoid disappointment. And that is how you actually get results. This podcast is for educational and informational purposes only. I am not a doctor, and I am not giving medical advice. Peptides are research compounds that are not FDA approved for most uses, and laws vary by location. Always talk to a qualified healthcare professional before starting or stopping any medication, peptide, supplement, or health protocol. Never use peptides if you are pregnant, breastfeeding, under 18, or have a serious medical condition without medical supervision. If you have severe pain, swelling, shortness of breath, chest pain, or signs of infection, seek medical care immediately. Thanks for listening, keep learning, and stay curious.